So welcome, everybody. Thank you for coming to the 4th annual White Coat Ceremony, a very exciting day for all of us. And today I have the distinct pleasure of welcoming our newest residents into the MLK Community Healthcare family. Here at Martin Luther King, our focus is on caring for the underserved. And so we've structured our curriculum around it. We've crafted rotations to give folks expertise in caring for this specific patient population. And it is different than caring for the population at large because there are unique challenges that affect our patients that you don't see everywhere.
Because we're serving a population of patients who have been basically medically neglected for decades, what we'll see in a lot of cases are very delayed presentations of common illnesses. So by the time the patient gets here, it's really severe and may not present in the way that you're used to.
Every internal medicine residency program has a requirement for a continuity clinic. And essentially you establish a panel of patients that you'll follow longitudinally throughout your 3 years in the program. One of the things that I think is particularly unique is taking that model actually out into the streets. The ultimate goal is to have patients that are unhoused come into the clinics to be able to get all of the care that they need. And I'm optimistic that our residents will actually facilitate that.
Everyone deserves health care, but certainly not having that access gives you a chance to do something that is really special for these patients. It's a big reason why I came here, and a big reason why I like teaching here, is that 30 minutes with a patient who has barely ever had access to a doctor before can literally be life-changing.
Eso, mi amigo.
When we're looking for applicants for our residency program, the two most important things that I'm looking for are, one, a real desire to help this community and work with underserved patient populations. And the second thing is humility. And to come with a real sense that you can learn from anyone, any situation, and you just have to be willing to receive that.
I got a chest X-ray on you. Your chest X-ray actually looks a lot better than yesterday, so which is good, right? Because I want you to also take your seizure medicine, right? I think that's why you passed out. I think MLK being a little bit of a newer residency program means that being creative, being resourceful, sharing your ideas is going to be very well received. If you're ready to work hard and roll up your sleeves and think a little outside the box, it's going to be great.
The 63-year-old male, history of type 2 diabetes, initially complicated by acute renal failure, intubated, but he's following commands. The patient population here, you definitely see different patient presentations that you would see elsewhere, which unfortunate for the patients, but it increases your breadth of knowledge and what you're able to see as a doctor.
One thing that's unique about our program is that we do also get outside rotations, like at Cedars or UCLA, Ronald, Reagan. If you're trying to be a hospitalist, I think it's trying to expose yourself to how things are done at other places is going to be invaluable moving forward.
One of the great core things that we can bring to our residents here is such a high ratio of faculty to residents because we have such a small program that relationship really is very close and that we can communicate on a daily basis.
It's very rare that you're able to be on a texting basis with your program director. As a person who kind of thrives in making community where I work at or learn at, it is the best place for me to be at, I will say. Very family-like.
That's really what MLK is, a family. It's not just a hospital or a healthcare system. We're a tightly knit group of diverse yet like-minded individuals bonded together by a common goal to deliver the very best healthcare to the underserved communities of South Los Angeles and beyond.
I feel like one of the biggest benefits to working at MLK is feeling like you can really make a difference and you're needed here. We actually have an over 1,200 physician shortage in this area, so we are not oversaturated. The patients really need our help.
You know, one of the things I think that's most special about MLK from a trainee's perspective is that you can really make a difference from your very first day. You can be very green, right out of medical school, and help somebody navigate the system without knowing anything about their medical problems. You just have outsized influence in your patients' lives. They trust us inherently. As you receive your coat today, embroidered with your professional title of doctor for the very first time, you officially join our family of healers. You'll rely on your co-residents, faculty, and other staff in ways that you never had to as a student. The experience will be exciting, stimulating, educational, and fun, but it will also test your strength and resolve in ways you might never have imagined. Rest assured that no matter what comes your way during the next 3 years, your MLK family will always have your back.